In 2002, an interdisciplinary summit was held to recommend approaches to accomplish the aims of the Institute of Medicine's 2001 report, Crossing the Quality Chasm. The summit reported that all health professionals should be educated to deliver patient-centered care as members of an interdisciplinary team, emphasizing evidence-based practice, quality improvement approaches, and informatics. The Institute of Medicine then outlined 5 core competencies for all health professions: provide patient-centered care, work in interdisciplinary teams, employ evidence-based practice, apply quality improvement, and utilize informatics. All 5 of these competencies are utilized in my everyday practice. The nursing professional practice model for my hospital includes each of these competencies, although some in different wording. Of course, at the root of everything is patients and families, or patient-centered care. On my inpatient unit, every move that is made is to provide the best possible care for my patients. The competency work in interdisciplinary teams is shown in the 3rd ring of the practice model in the form of collaboration. The attending physicians and residents, along with physician's assistants and nurse practitioners that are assigned to care for our patients, along with the hospital's pharmacists, care managers, physical, occupational, and speech therapists, and everyone else in between, is always readily available to aid in the care of each and every patient. Each of the members of the team throughout the hospital is very good about speaking with one another and communicating issues or concerns about the patient's care. If I have a question, concern, or update about a patient's condition, I have no problems with getting to the person I need, and my concerns never go unaddressed. The 3rd competency, employ evidence-based practice, is evident within a few places in the practice model under the terms discover, knowledgeable, and adaptation. All care is given keeping evidence-based practice in mind, whether it's something I was taught in nursing school or a policy my nurse educator updated the unit on based on new research that came out. Every week, our unit's nurse educator sends out an education email notifying us of updated policies or reminders of certain policy guidelines, along with presentations or fact sheets about topics we need to be aware of in our practice. Along with that, our yearly online education bundles are constantly being updated by the hospital based on new practice guidelines. Competency number 4 is apply quality improvement, and that is in one of the rings of my practice model. High quality care is always the central focus of my job, because if the care I'm providing to my patients is not continually improving, then I am only doing a disservice to my patients. With the shared governance within our hospital, we have a Performance Improvement Council with a representative from each unit. Our unit is currently focused for this year on becoming more aware of hospital-acquired pressure ulcers and employing practices to reduce the incidences within our unit. The Performance Improvement Council also constantly monitors incidences of fall rates, catheter-associated urinary tract infections, and central line-associated bloodstream infections. The last competency is to utilize informatics. I use informatics every minute of every day in my practice. I am fortunate enough to work at the main hospital within a large healthcare system, so I have at my fingertips every advanced technology that the hospital is constantly looking to help advance. I utilize electronic charting and medication administration records, state-of-the-art cardiovascular monitoring systems, and communicate electronically with physicians, among many others. My workplace, although exceptional in many areas, could of course improve in other areas. One competency that could be improved upon is working in interdisciplinary teams. As stated earlier, it is very easy to get in touch with anyone that I need to in order to get or to give information about my patients, but there are many times I would like the collaboration improved. The idea of having nurse-led rounds in our unit is something I would like to explore, because most of the time the physicians ask the nurses on the unit if there are any needs or concerns with the patient they are seeing, but sometimes they do not. There are times when the patient is seen by the team, but they don't update the nurse on the plan of care, and that can impede the patient's progress. In addition to including nurses, I believe my hospital could improve interdisciplinary teams by trying to include pharmacists in routing. There are a few medicine services that do this now, but I think it would be very beneficial to try to have this done more often. Sometimes the physicians are so focused on certain aspects of the patient's illness that they may not realize some medications they have prescribed could be changed to improve response depending on the patient's demographics or comorbidities, and a pharmacist is a good resource to have on hand for that purpose. On the other hand, the competency I think my workplace excels in is utilizing informatics. This is using information technology to communicate, manage knowledge, mitigate error, and support decision making. In my facility, nurses do not take any verbal or telephone orders. Every single order is placed electronically by the attending provider or the provider on call, so error is mitigated there. In addition to that, to contact providers about orders, questions, or patient concerns, we have a paging system with an online phone book integrated into the facility's intranet, along with a communication tool called Tiger Text, which is an instant messaging system utilized through the computer and a phone application that provides a much better communication than pagers. As far as informatics in the nursing realm, we have on our computers a program in which we can find the compatibility of profiles of intravenous medications, and the IV pumps we have use drug libraries within them with notifications of high or low rates or dosages of programmed medications to be sure they aren't given too quickly or too slowly to be harmful or ineffective. Here is a visual demonstration of how I utilize the core competencies in my area of practice. As far as these competencies go, the very definition of competency speaks to critical reasoning and reflection, so critical thinking is a necessary prerequisite to meeting these core competencies. Each one of these competencies has within it checks and balances that influence reflective cognitive processes, so everyone in the interdisciplinary team is critically thinking about the evidence-based practice that they employ to continually apply quality improvement standards into care, and reflecting on how they can best utilize informatics to put all of this into practice to provide the best patient-centered care possible.